Hi everyone, I'm here with Ester Leotte. Esther is a PhD candidate in strategic communication at the Faculty of Social and Human Sciences, Nova University of Lisbon. She holds a degree in marketing and advertisement, and she is currently marketing director of the Advanced Care, a health service company in Portugal. The title of her poster is Improve the Use of Telemedicine in Portugal, a proposal based on insights from actual users and potential consumers.
Hi, good afternoon to all. The project's idea started because telemedicine seems to be a solution to increase access to health to all population, to improve Portuguese health system sustainability, and also to offer the convenience that consumers are asking for today. With that in mind, I thought that it would be interesting to investigate more about what is being done in Portugal related with telemedicine, both in public or private sector, and understand more deeply how telemedicine can be consistently implemented in Portugal. However, since my project was approved, and it was 6 months ago, global context changed because of COVID-19. The pandemic crisis modified project's initial problem, that was the lack of utilization and engagement that from patients to teleconsultations, when public and private sectors were already promoting them. In the other hand, the use of teleconsultations increased exponentially during quarantine in Portugal, as it was the only way to have a consultation. So, and despite the change of project's initial problem, the main goal gained even more interest. Therefore, the project's target was maintained, the new health client or patient, as well as the research question, that is, what are consumers or patients' expectations about telemedicine in Portugal? With this research, I'll study what consumers think about teleconsultations, and how are these services evaluated by the ones that already use them in order to leverage the high utilization that we experienced during the COVID-19 crisis. So the first step of the project has been reading a lot about previous studies with two main goals. First, understand teleconsultation state of heart in Portugal, like history, actual context, and challenges of implementation. And second, understand the consumer of these teleconsultations and their engagement to care and to digital solutions. Second step will be the research and analysis of consumers' perceptions and insights related to teleconsultations in Portugal. The research design is organized in two dimensions: a subjective dimension based on consumers' expectations, and an objective dimension based on users' experience. And data will be collected through two methodologies: online questionnaires applied to the larger population possible and using scales already tested. As an example, patient engagement scale from Grafina 2015 that I would like to use. And second, interviews applied to telemedicine managers as well as to users. These interviews will enable us to understand what is motivating patients to adopt these services and how was the utilization experience. By the end of the research, it's expected to have two things: a list of the teleconsultations available in Portugal and its utilization, types of services, etc. And second, a list of insights from consumers or users to improve services and communication in order to help telemedicine implementation in Portugal. The project will be divided in 5 phases that started in the end of 2019 and will end in 2022. The first, the literature review. Second, data collection related to services and interviews to managers. Third, preparation, answers, collection, and analysis of the online questionnaires. Fourth, interviews to users. And fifth, the essay and conclusions. And that's all. I think that in a resume, that's my project. Thanks for having this time to let me explain my projects. And bye. Thanks again.